There's certain heightened levels of bacteria in the mouth that cause dysbiosis that are linked to fertility issues. Over 65% of women go through some sort of dental disease of some kind during or soon after their pregnancies.
Why are we even talking about oral health?
It impacts sperm motility and sperm count significantly. Inflammation from the mouth has been linked to premature labor, lower birth weights, and preeclampsia.
Why inflammation in the mouth or in the gums for both men and women can kind of reduce that fertility.
Your body's immune system is going to come and be fighting. The biggest things are mercury, infected root canals. We didn't even touch on those, and those are huge. Oral health has everything to do with.
Hi, this is Ronit, WeNatal co-founder. I'm super excited to interview my friend, Dr. Lydia, biological dentist. We talk about the impact of your oral health and fertility and why when you're trying to conceive, it's super important to take care of your mouth. And we dive into the connection between your oral health and the overall health of your body. Tune in, you're not going to want to miss this one. Dr. Lydia, I am so happy to have you here. You are not only one of my best friends, but one of the most brilliant doctors that I know who I learned so much from. And I'm so excited for you to be able to share your wisdom with our community.
Thank you. It's an honor to be here. You're going to make me cry. You're amazing. Thank you.
Okay, so we're here to talk about oral health and fertility and pregnancy and outcomes. And some people might be asking, what does oral health have to do with it at all? So I learned this from you a few years back, and let's get started. Tell us how and why are we even talking about oral health?
Because oral health has everything to do with pregnancy, not only for the pregnancy, the success of the pregnancy, but also for the future oral health of your baby. So it's not, most of us, like, so when I was pregnant, I was always worried about the baby, like, especially with my third pregnancy, because I had a loss. I'm like, is the other one okay? Is the other one okay? So when a woman is, let's go before pregnancy.
Yeah.
Fertility. Research shows that chronic inflammation from the oral cavity, from an infection, and it's mostly from your gums or an infected root canal or an infected wisdom tooth. Chronic infection that's living in your mouth can impact the amount of time that it takes you to get pregnant as a woman and as a man as well, because we like to focus on him here as well.
Yeah.
Neonatal. It impacts sperm motility, so
Wow.
how fast a sperm can move, and sperm count. It impacts that significantly. So now in my practice, I'm starting to test all the men who are trying to conceive and their counterparts. There's an oral DNA testing, and there's certain bacteria, heightened levels of bacteria in the mouth that cause dysbiosis that are linked to fertility issues.
Wow.
So it's very significant when you're trying to conceive. Now that you've conceived and you're pregnant, that is going to impact not only the outcome of the baby's inflammation from the mouth has been linked to premature labor, lower birth weights, and preeclampsia.
Wow.
As well. So it's very connected. And also, do you want to have a cavity, and do you want to get drilled on, and do you want to be dealing with dental disease in your postpartum phase? Anyone who's had a baby, that's the least thing that you want to be dealing with, right? So over 65% of women go through some sort of dental disease of some kind during or soon after their pregnancies.
Mm-hmm.
Why is that?
Yeah.
When you're pregnant, I had a really hard time brushing and flossing, and especially in my first trimester, but I had morning sickness throughout my pregnancies. What do you snack on when you don't feel well? Like, what do you eat?
Crackers.
There you go. These are like some of the worst foods that you can, like cavity causing foods. You sip on some sparkling water, and we sip on 7-Up. and like Sprite. Like that's what my mom gets me when I tell her like, oh, I'm nauseous and I
Yeah.
don't feel good.
Yeah.
I think it's a cultural thing.
It's a cultural thing.
Yeah, but
My daughter threw up once, and my parents were like, we need to get her Coca-Cola. And
exactly.
I'm like, what
No.
are you talking about?
I know, but it does make you feel better. The carbonation, and
Yeah.
carbonation is acidity, and you just threw up and you're having more acidity, so you're already acidic.
Hmm.
Um, you're pretty tired while you're building a baby, so your oral hygiene is down. Like a lot of the time, like the first 4 months of Thomas's pregnancy, I couldn't brush my teeth or floss.
Just at night, like you were so tired.
Not just tired, I was so nauseous. It caused my gag reflex to like it accentuated my nausea and my
Wow.
and I would vomit. So
Wow.
I recommend pregnant women who are undergoing that or have severe nausea to use baby toothbrushes. That really helps
Oh,
because it's a smaller size. But you're the morning sickness, and then also you're not as thorough. You're like not taking care of yourself as well. You're so tired. The countless times that I've slept watching like a TV show,
you
like
just fell
you
asleep.
just fall asleep,
Yeah.
and you're probably falling asleep while you're snacking and sipping on that, that drink that mine was usually carbonation because that was the only thing that would call like club soda, ginger ale. So we're not eating as well. There's high levels of acidity in the foods that are curbing our nausea. Generally, of course, not everybody's like that, but a lot of women are, and that really impacts. And then they don't visit their dentist because they think that it's unsafe. There's a huge myth that it's unsafe to visit your dentist during your pregnancy.
Unsafe. Why is
Unsafe.
that?
This is an old myth. They say you lose a tooth per pregnancy and don't visit your dentist because it's unsafe for it's these are just myths. Both are
Wow.
false. You're not going to lose a tooth for every pregnancy, and not only should you, it's necessary
Like
to
to
visit your.
get on like a regimen of even more teeth cleanings than usual.
Yes. Yes. So I was getting teeth cleanings every month.
Once a month
I
because you
needed that
couldn't
help.
brush, so you
Yes.
needed that like extra support.
Yes. I'm a more extreme case, but someone who's having a normal pregnancy, I would recommend two cleanings, one at the end of your first trimester and one at the end of your second trimester,
Hmm.
just to keep things in check. And then postpartum, once you're done Q4, I call it Q4, the fourth
Q4.
trimester, then come in and get yourself checked and just to keep things at bay in your
Yeah.
mouth. And also, while you're pregnant, you get more congested, especially as the progesterone rises. And when you're more congested, you start breathing through your mouth because you're unable to breathe through your nose. And and that causes a lot of problems as well with your microbiome. So it's all related to microbiome. The
Mm.
way that you're eating, the inability to clean properly, more likely to sleep with your mouth open, especially as you're getting bigger and progesterone's rising. I have countless
And
patients.
also, as you're getting bigger in general, it's just harder to sleep. And you start, for me, like I'm a snorer. When I'm pregnant, I snore. My husband will argue that I still snore now. I don't think that I do. I think
There's
it's
an app you
more.
can download and it'll tell you.
Oh,
Yeah,
really?
it's called the
Okay.
Snore app.
Okay.
Yeah.
Okay. We'll check.
You should, and so prove him wrong, hopefully wrong. And
Yeah.
if you are, tape your mouth and see what happens.
And do you recommend mouth taping for women when they're pregnant?
That makes me a little nervous. It really depends on the woman. It depends on how severe is her congestion, because I need you breathing,
Mm.
right? And so all my pregnant women, I put them on a nasal hygiene protocol. We and once they're able to control their food intake, like they proper nutrition, whole foods, that impacts whatever causes you to have more phlegm. For example, if I drink dairy, and I love dairy and I drink raw dairy, but even that causes a little phlegm for me. So I avoided that at all costs when I was pregnant, but try to control whatever food sources cause extra congestion,
Phlegm.
phlegm. So nasal hygiene. So I would nasal spray every single night when I was pregnant. I'd like spend a good 5 minutes cleaning my nose. Like nasal hygiene is as important as oral hygiene, if
Wow.
not more important than oral hygiene.
Okay, so what is nasal hygiene?
Okay, nasal hygiene is exactly it's cleaning your nose. Like we're completely missing that part for our whole health. It's not just for oral hygiene, but when you're not breathing through your nose properly, you're going to breathe through your mouth.
Yeah.
Okay? And when you're pregnant, and even before you're pregnant, and especially for like men who are trying to conceive, so when you're breathing through your nose properly, you're producing nitric oxide. Nitric
Mm-hmm.
oxide is very important for vasodilation and for proper oxygenation of your entire body. And low nitric oxide has been linked to erectile dysfunction.
So vasodilation is basically what Viagra does.
Exactly.
So, okay, so pay attention. Men, pay attention. So, if you want basically better performance, essentially,
Yes.
no nasal breathing and
Essential.
essential.
Essential. It's very, very important. And your man will feel better. Like he'll wake up in a better mood, you'll have better sex, you'll be more at ease, and he won't have bad breath. Like it's all so linked.
Yeah.
It's very, very linked. So, also bad breath during pregnancies. Like a lot of pregnant women, they come and they feel like their microbiome has changed. Like Dr. Lydia, I feel like I have bad breath, and it comes down to them mouth breathing. And then when you have oral dysbiosis, your propensity to get dental cavities and gum disease rises significantly.
Mm-hmm.
So, yeah.
So back to the nasal
Yes.
regimen.
Hygiene. Yes.
What does that look like?
Okay.
Like practical.
Practically, I always have two things bedside. Well, actually, one is in my bathroom and one is bedside. The bedside is the nasal rinse. So it's like the X Clear. I have an oxygenation one. Anything spray that you're spraying up your nose. It can
Okay.
be basic saline. You
Okay.
need something just to like stir things up, to loosen things up. And what I do, I gua sha my face. I spend a good 5 minutes trying to do that. But when I don't have the time, because now I have 3 kids and I have time for nothing, I always spray. I go like this, and then I clean my nose. Like I make
Like
sure
blow your nose.
I blow my nose. Whatever you need to do to get it clean. Like pick your nose, do this in private. Pick your nose, blow your nose, clean your nose. Like make sure you can breathe through your nose.
Okay.
If you can't, if you have a septal deviation, if you have an obstruction, that is one area that I tell people, please go to an airway centric ENT, get checked, see what the obstruction is from. Like if you need surgery, do the surgery. This is one, like I'm very conservative with surgical procedures. Less is more. My prevention is my thing. But if you're an adult with a septal deviation that's not going to resolve on its own, and you can't breathe through your nose, you are cutting years from your life.
Wow.
Like you can live without your teeth, but we don't want to live without our teeth. But your heart needs oxygen.
Mm-hmm.
Your brain needs oxygen. So it's super linked to proper bodily function. So I clean my nose really well. Days that I'm more congested. So when my progesterone was really rising, I was feeling it's called pregnancy rhinitis. So I felt like I had a cold. I was pregnant. I felt like I had a cold, but I didn't have a cold. I would neti pot my nose. So I rinse it. Like I use the NeilMed sinus rinse. That's my favorite.
Yeah.
I ozonate some water. I put in the saline packet. The saline has salt and baking soda, and I mix it, and I literally lavage my nose. And it just opens everything up. And then I take some peppermint essential oil, I rub it on my hands, and I smell it. So it just opens everything up. Then I'll sleep.
You can use regular water if you don't have ozonated water.
Yes, you can use regular water, preferably distilled or filtered water.
Yeah.
You don't want to use tap water for this.
Yeah.
I just wouldn't want that, especially if you're doing this for your kids,
Yeah.
which I highly recommend if they're congested, because you definitely don't want your kids mouth breathing.
And this is something so basic that you could just get at CVS.
CVS, the best $20 you'll spend.
Yeah.
I think it's $15 for the lavage and like $6 or $10 for the rinse. Put it bedside with a box of tissue, you're all set.
Amazing.
It's so easy. It's so essential. And then if you do live in a dry area, have a humidifier, okay? Because if you're super dry, your nose is going to want to create more mucus. But I have right next to my bed my air purifier and a humidifier that I turn on depending on the season and the dry business. So that's how you are not only clearing out your nose to properly breathe, but you're also breathing good quality air.
Yeah, amazing.
Air, especially, and we live in LA, so yeah.
The air is polluted.
Yes, very. Yeah.
Okay, so wow, Great tips. Let's go back to the fertility preconception stage. And what is the underlying reason why inflammation in the mouth or in the gums for both men and women can kind of reduce that fertility?
So, it's such a great question. So, the way I look at it is you have multiple faucets of water open, and each one of these faucets is a source of inflammation. Okay. So, if you have gum disease, you need a deep cleaning, your gums are swollen. That is a chronic source of inflammation from your mouth.
Mm-hmm.
So, your body's immune system is going to come and be fighting in your mouth, like just fighting. It's fighting an infection. What do you think is going to happen energetically to your body?
Yeah.
Are you going to be feeling good, or are you going to be feeling drained if you have multiple sources of infection?
Yeah.
It's draining. And we've actually had a few patients that have taken their CRP levels, C reactive protein, which is indicative of the inflammation in your body, before and after deep cleanings. And research supports all this, but it's nice for me to do some of this research in my clinic
It's
because it's
amazing
nice
to
to
see.
see like, is this true or not? And these are young women, like our age, like even a little younger. They needed legitimate deep cleanings. We do the deep cleanings properly. We retake CRP and it is significantly lower.
Wow.
So that just goes to show you that oral inflammation is linked to it travels to the rest of your body. They've they've shown, like research is showing the link between gum disease and Alzheimer's, link between gum disease, like certain bacteria, like oral dysbiotic bacteria and colon cancer. Um, Preterm labor, lower birth weights, we're all connected.
Everything is
Our
connected.
our mouth is the first stop of our digestive system. So if there's dysbiosis there, there's dysbiosis everywhere.
Wow.
Everywhere. So,
This
yeah.
is why you're so passionate about
Yes,
what
I
you
get very
do.
excited. I hope I'm not
And
too intense.
no, it's amazing. And it is so just like understanding that connection between everything is connection. We talk about the mind body connection, the mouth body connection. You even shared with me the mouth vagina connection.
Yeah.
So let's talk about that. How are those two things connection? What does the mouth have to do with the vagina?
So our oral tissue is very similar to our vaginal tissue. They heal quickly. They have estrogen and progesterone receptors. So our mucosa, we have estrogen. That's why, for example, when you do get pregnant or when you do get your period, when you're on your cycle, a lot of my patients like, I can tell when they're on their cycle, when they're close to their cycle based on
Their mouth?
their mouth. Yes.
Wow.
Because as the estrogen and progesterone is rising in your body, your gums are a lot more sensitive to the plaque in your mouth. So you bleed a lot easier, you can experience more pain, and it's just more sensitivity, more sensitivity. So I was noticing that in my patients and I'm like, gosh, like why, So vaginal tissue and oral tissue, the oral tissue stem from the same germ layer, which to me is incredible. Like they come from the same germ layer. So the quality of the tissue, the type of tissue is they're identical in some areas and extremely similar in other areas.
What does that mean, germ layer?
So upon conception, the eggs are dividing, and then different germ layers create different areas in your body and of the body. So from one area you get your gut, your heart, your lung, etc. From another one you get your eyes, your mouth. It's the same germ layer creates your vaginal tissue and your oral tissue.
Wow.
Like that is huge. That is so, and that makes so many things make so much sense.
Yeah.
Because what I'm finding is trauma of all sorts, not just oral trauma, but any sort of trauma really impacts a woman, and it stays in your nervous system and everyone's gone through some sort of trauma in their life.
Yeah.
And it stays trapped. And your mouth is part of your throat chakra. It's not just your throat. Your ability to speak. Mm-hmm. You're speaking through your mouth. Your mouth and teeth and tongue and your oral mucosa is part of your throat chakra. And I was just telling you about a recent patient who was telling me she was having a really hard time with intimacy. She feels like her mouth is shut, like she is experiencing so much, she's experiencing so much depletion. She's not taking care of other things in her life, and it's all showing up in her mouth and her femininity.
Wow.
So it's all so linked. It's like if there's a spiritual component to this.
So you want better sex.
Yes.
You have to get those mouth,
Yes.
not only the baby, but the better sex. You have to get those teeth cleanings. You have to take care of your mouth, your gums, do that nasal spray.
Yes.
I think like for you, it doesn't sound sexy, but it is sexy.
It is so sexy to not have bad breath. It is so sexy for you to be properly oxygenated so you can be alive and well.
Yeah.
It is so sexy to be able to perform. I'm sure as a man, right? I don't know. I'm not a man, but I'm sure you'll feel better when you're able to perform properly. And it's sexy not to have gum disease and dental decay. Like to me, it's so like it's so obvious, but it's not obvious.
Yeah.
Because I'm the one drilling on teeth, and I don't like drilling on teeth.
Yeah.
It's horrible to drill because it's very traumatic, the noise, and like a lot of people don't love going to the dentist because of that. But then whenever they come, for me, it's so important. If you're in my chair, I can teach Julia and Eden our kids to drill.
Yeah.
It's not difficult. What's very important is to find out why I need to drill in the first place.
Yeah.
Why did you get the cavity? When did you get the cavity? What were you eating? Were you supplementing? Are you low on vitamin D? Are you mouth breathing? There's so many questions we ask to get to the root cause of it.
Yeah.
So, and it really impacts fertility, and also it impacts our babies because we pass our microbiome to our children.
So interesting.
So we're kissing them. We're sharing spoons, which we shouldn't be. We shouldn't kiss on the mouth.
God.
We
My
shouldn't
kids
like
have a new
pacify.
thing with like the tongue to tongue. I'm just like
Tongue to tongue? Oh, tongue?
it's just like they just think it's so funny between each other.
That's so cute. But no, please.
No.
No. But, and also your partner, like make sure your partner, cavities are contagious. Gum disease is contagious. If you are kissing your partner and they have gum disease and cavities, you are getting the dysbiotic bacteria causing that. So
Yeah.
it spreads. It's very important.
So important.
Yes.
So you mentioned vitamin D. How is vitamin D at all, or what are some other nutrients that make an impact on oral health, if any?
Such a great question. And yes, their vitamin D is huge. I can tell if someone's vitamin D deficient by their x-ray.
How
So
is
you
that?
start getting changes on a dental x-ray, the way the pulp chamber is shaped. Maybe I can send you a picture and you guys can put it and I can circle it. So the pulp chamber changes shape when you're chronically low on vitamin D. So there's vitamin D3 and K2. Very, very important. Why? Because you need vitamin D3 and K2 to grab the calcium and take it to the correct place.
Mm-hmm.
So if you have only good amounts of D3 and calcium, but not K2, that calcium's not going, it's there, but it's not getting transported to the correct place.
Yeah.
It's like, I have a gift for you, but if I don't know your address and I don't have a postal service that can get me to your address, that gift doesn't mean anything to you.
Yeah.
And it can be exactly what you need. But if it's not getting to you, it means nothing to you.
Yeah.
So vitamin D3, vitamin K2 are very important. Calcium is also very important. Potassium, magnesium, zinc, omega-3s, everything in Weenatal, honestly. I've like very, very,
Also,
very
side note, all of these nutrients that you're mentioning, zinc, vitamin D, omegas, magnesium, are the 4 key nutrients that Dr. Lisa Song talked about as far as healthy babies and often deficiencies that she sees in children that impact their cognition, that impact their mood, that impact their behavior. So it's not just important for oral health, but as you could see, everything is connected.
But God doesn't make mistakes. Like the mother should be consuming, whether so I wasn't able to consume any of these things. I was getting IV vitamin drips from a dear friend because I was not able to consume. And I couldn't, you tell me put wee needle in our smooth. I couldn't do that. Right now is the first time in my life, postpartum with Thomas, I've been consistent with all my vitamins and I'm feeling better than ever. I'm able to breastfeed better than ever. I feel he's my healthiest baby, to be
Yeah.
honest, at that
Yeah.
stage. And it breaks my heart that I didn't know better with my first two, but it is what it is. You live and you learn.
You live and you
And then you
learn.
tell me about Elisa Song, Dr. Elisa Song, and then you sent me research about how important the omega-3 is for me, for my child to get through my breast milk, and I feel a difference.
And also, can we talk about your hair?
Oh, I'm kidding. I've never gotten so many compliments on my hair, like all my life, like never. But I have great hair growth for the first time ever
Yeah.
postpartum. I lost a little bit, but I had plenty, so I could afford to lose from some. But before, with my first two pregnancies, I was like literally bald here.
Mm.
I got very self-conscious about it. So yeah, thank you, Nenatal.
The power of
The power of
nutrients.
nutrients. I also eat very well now. I do eat a lot of liver. Liver is wonderful for you.
So
I feed
yes,
that to my
tell
kids.
us about like how does a biological dentist eat?
Oh my God. So I try to see, like when I'm looking at my plate, I need to see where my food comes from. If I don't see where my food comes from, like if it's meat, I need to like it's a piece of meat, a piece of salmon. So nothing processed. I have to say this because I say this in every single interview and please do not consume goldfish, the goldfish
Oh
crackers.
gosh.
Please don't give them to your children.
Yeah.
Don't put them in their lunch boxes. They are absolutely probably they're just as bad as Sour Patch Kids
Or
or
worse
like
than
worse
candy.
than
It's
candy because they
sticky.
stick and they're white so you don't see it and they don't brush properly in the areas where it sticks. So I try to just consume whole foods like good quality meat, vegetables, root vegetables, potato. I love potatoes, sweet potatoes, carrots, zucchini, lots of salad. I eat a lot of tabbouleh. I'm Lebanese, so like lots. So I do consume a lot of lemony foods, and a lot of people ask me how do I deal with that. I drink a lot of water, and I don't brush my teeth right after I brush. A lot of people go eat, and then they go brush their teeth right away. Every single time you eat, the acidity in your mouth
Goes
normally
up.
goes up because you're breaking down the food. The last thing you need is to scrub your teeth right after your
Oh,
meal. So
interesting.
you want to wait half an hour and drink a lot of alkaline water as well. If you're going to be drinking lemon water, drink it through a straw.
Also, you told me sparkling through a straw because I'm a
Yes,
sparkling girl.
yes, please. If you're a sparkling human and you are sparkling, it can really destroy your teeth if it's constant carbonations coming into your mouth. So I also am limiting snack. Now I'm breastfeeding, so I do snack a lot. I'm grazing throughout the day, but before I try to limit snacking, I try to limit it for my kids and for me because
Yeah.
when you're chronically snacking, your mouth is chronically acidic. When your mouth is chronically acidic, so how do cavities form? So you have a pH balance, right? You want it to be in balance. If you're chronically snacking, your pH is going to get offset and it's going to be chronically
Mm,
acidic. When it's chronically acidic, you're more likely to have cavities,
so
right?
interesting.
And even children, this is the same everything. So everything I'm doing for myself, I try to do and I try to educate my children. They don't always listen, obviously, they're children, but when they get older, I feel like it'll really sink in.
Oh, it's just
It's
modeling.
just
They end up
modeling.
doing what they see at home.
Exactly.
Yeah.
So I limit snacking, and then when you limit snacking, you get hungry. And when you're hungry, you're going to eat your broccoli and you're going to eat your
Yeah.
meat and you're going to eat all the good stuff versus just grabbing a quick meal on the go, which sometimes I do. But
Sometimes there's no choice,
sometimes
but
there's no choice.
what
Yeah.
we started doing is when my kids come home from school at 3 p.m., at 3:30, 4 p.m., they get dinner because they come home from school
Starving.
starving.
Yeah.
They don't eat all day because they just want to play. And then we do dinner first because if you start with the snacks, it's just like
Jambalaya.
yeah, then they won't eat that salmon that you prepared. So literally it's like a marathon. They come home and like the food is either ready or right then and there like I'm making dinner.
Dinner. That is so smart. And I've been doing that too. And when they're hungry, they're going to eat well.
Mm-hmm.
When a child is hungry, the healthier food is going to taste better.
Totally.
So and you change your children's taste buds based on what you offer them.
Yeah.
You change your own taste buds based on what you offer yourself.
100%.
So I really take that, and so Julia, my eldest, I'm teaching her that by modeling, but also like I tell her what I'm doing. I tell her it's better not to snack right now because if you snack, you're not going to eat your full dinner. And then
Yeah.
you're going to be hungry an hour later. Then you'll get another snack. And each time you eat, there's more acid in your mouth. I like talk to her about it. She's like,
Yeah.
yeah. And I'm like, do you want cavities? No, I don't want cavities.
Mm.
So it's really about like making them health conscious and making them
And they
also
understand,
they do.
even at a young
They
age.
understand, yes.
Looking at nutrition labels with my older daughter at like Costco one day, she's like, "Oh, can we get this? Please, so and so has it at school." And I said, "Okay, let's look at the ingredients." And this was like an ingredients list this long.
Yeah.
And I was like, "How many ingredients are in an avocado?" And she's like, "Oh, okay.
I love
Okay,
that.
I get it." And like never again.
Done.
And she gets it.
Done.
And so I think it's so interesting. And it's also interesting that you can change your taste buds.
You can.
Nothing makes me happier than when Emma, my almost 4-year-old, says, "It's too sweet."
Oh, I love her.
Like the other day, she found some like cookie that Eden brought home from some like goodie bag. And this was a cookie with frosting. So she was like, she took a bite of it. She was like, "Oh, like the frosting is too sweet." So she started eating the cookie from like the other side. And it just shows you like kids are not addicted to things. They're not born addicted to things.
They're not. No,
So
yeah.
I think it's just an important thing for parents out there. You're in charge.
You're in charge and you have so much power. Like you got to put the power back in you as a parent.
Especially before they go to school.
Yes.
Especially in those early years.
And then if you do it right 90% or 80% of the time when they go to school, they tend to make better choices.
They do.
Like Julia has refused a piece of cake because she already had her like sweet dose for the day. We also need to be very mindful that we're not creating children who are more prone to eating disorders or having a bad rapport with food. Like I will offer, like I tell them, you can have something sweet, but I prefer you have like, for example, a good quality piece of chocolate versus a Sour Patch Kid.
Yeah.
This one isn't going to hurt you as much as this. Mommy enjoys a piece of chocolate.
Yeah.
And instead of like getting your cake at, I don't know, Starbucks, bake a cake with your children so that they can see the ingredients of what's going on in that cake.
Yeah.
And also one last thing I want to say is that just because your child refuses something healthy once, on average, it takes exposure of 7 to 9 times for a child to start to like a food.
Yeah.
So I'm pretty strict in this. I'm making one dinner, and this is what's available.
Yeah.
If you want to eat, you're welcome to eat, and we're going to eat together. Once the kitchen's closed, the kitchen's closed.
Yeah.
So there's been a couple times where I've actually let my kids go to bed hungry, especially my eldest, because my daughter, my younger one, learns from her.
Yeah.
And after that, she ate her full dinner.
Yeah.
Like she sat down and ate. She wasn't playing. She said okay to not having a snack, and she ate her dinner.
Yeah.
Like, and then, so my sister-in-law recently came from overseas, and she was like, "I'm very impressed by how well your kids eat vegetables." And I'm like, it's not by chance. That's all I would offer them. Like play dates, when I have play dates, I have a huge board of fruits and vegetables. When kids are hungry, they're going to come and eat those.
And by the way, I know you practice what you preach because I've been to your house. I've been at birthday parties. It's beautiful and fun, and the kids aren't missing anything, and it's also so healthy.
Yeah, I don't want to send a bunch of sugar. Like, I mean, my kids have sugar, and we have the cake. It's just not the predominant thing that we have.
Yeah.
Like, that's not what's constantly being offered. And I think that makes a huge difference for our children.
Huge difference.
And for like us, like when I'm eating well, oh my God, I feel like I can cope with the sleepless nights.
Yeah.
I can cope with more stresses during the day.
Totally.
Because I'm feeling better. I'm not depleted. So
food is medicine.
It totally is. And like proper supplementation and proper sleep. And then also taking care of your spirit,
Yeah,
you know,
that's a big one.
that's a huge one.
One last question, dental related. Talk to me about tongue scraping
Yes.
because I know you're a big fan and I do it every day because of you.
Yes.
Yes.
I love tongue scraping. Unless you have dry mouth, tongue scraping is wonderful. If you have dry mouth, you need to figure out why you have dry mouth. Like tongue scraping can actually hurt your tongue if you have dry
Mm,
mouth. I'm noticing that in menopausal women
interesting.
and in patients who have autoimmune conditions and are on medications that cause dry mouth.
Mm.
So that being said, it's an Ayurvedic practice that has been around for a very long time. I recommend copper tongue scrapers, and tongue scraping is the first thing I do every morning. So we detox when we sweat, we detox when we go to the bathroom, and we also detox through our tongue.
Hmm.
And in the morning, the first thing I do is I take a tongue scraper, I stick my tongue out, and I scrape it gently 2 or 3 times and just see what comes out. Okay. And notice how the way your tongue looks when you're sick versus when you're not sick.
Hmm.
And when we have oral dysbiosis, there is a lot more white film on our
Hmm.
tongue. And when our mouth is healthy, our tongue is a nice pink that looks healthy.
Yeah.
So our tongue tells us a lot.
Yep.
So um, constantly cleaning our tongue is extremely important to avoid oral dysbiosis, to cleanse, and please don't brush your tongue.
So do you do it in the morning only or at
No,
night too?
I do it in the morning 100% of the time almost. At night, I do it like 60% of the night
Got
of the
it.
time. At night, I prioritize flossing really well and making sure I get in between each tooth and hugging each tooth with the floss and really conscientiously like you got to think of each tooth as an organ.
Mm,
If you're not
interesting.
flossing, you're not cleaning 40% of your surface area of your tooth structure. So imagine you're showering, but 40% of your body is not getting cleaned
Wow.
day after day after day. You're okay for a week, you're okay for 2 weeks, but long term,
Yeah.
you're going to start to stink. And
Yeah.
literally in your mouth, you start to stink.
Wow.
Like I can tell, like I went 3 weeks without flossing when I was pregnant. It was disgusting.
Wow.
It was very humbling and it was very disgusting.
Yeah.
But also, just in anything, flossing is a habit.
It's a habit.
It's a habit,
Like the tongue scraping, which
like the
I
tongue
started to
scraping.
do, and I get this like positive feedback from it when I do it and I see what comes out.
Do you feel good
I
though when you
feel
see that?
amazing.
Yes, yes.
And so, same, I'm gonna be honest, I'm not the best flosser, but like building that habit
Yeah.
is,
And it's like, and that's why I think it's so important to have a beautiful rapport with your dentist
mhm.
because just in anything, it's a relationship. And I'm guiding my patients. I'm not perfect. They're not perfect. And every time I see my patients, there's a little tweak that we'll do for their oral health
Yeah.
routine. They tell me what they're doing, they tell me what they're faltering and what they're doing right, and then we make little changes. If I hit people with everything all at once, I'm going to turn them off and I'm not going to be able to get them to do things that are ultimately good for their health. Like
Yeah.
so it's a process, it's a journey. And I've had people that have been coming to me for years, and at the beginning, they weren't doing anything. And now they have multiple stackable habits throughout the day. So people tell me if I had to choose when to floss, morning or night, night.
Yeah.
If I had to choose when to tongue scrape or morning and
AM.
night, AM.
Yeah.
Do you brush before or after breakfast? Before breakfast.
Hmm.
After breakfast, you don't want to be brushing your teeth. You're probably out the door.
Mm.
If you feel you need to do something, floss and rinse with baking
Mm.
soda. You don't need mouthwash. Please no alcohol in your mouthwash. So these are all little tips
Yeah.
that over time people start building.
So you are a biological dentist.
Mhm.
How can people find doctors like you?
Such a great question. So there's a few organizations, IABDM, IOMT. They're the Biological Dentistry Organization. One is an international organization, and one is local in America, or I think North America. Um, Also, there's like accounts like, for example, Dr. Mark Brehene, Ask the Dentist. He has a functional dentist directory. And my favorite is word of mouth.
Word of mouth.
Word of
Yeah.
mouth. Like I feel like the other day, I think I texted you, I'm like, do you know this sort of practitioner? Like you're one of the people that if I'm looking for somebody, because
Same.
first of all, you know so many people and I also trust you.
Yeah.
So, and and I don't want people to just focus on biological dentistry as much as like I think every single dentist should be a biological dentist, but not everywhere in America or the world do people have access to biological
Yeah.
dentistry. So I always want to try to make solutions for people. I think you should find a dentist that you can connect with,
A good person
a
that will
good
listen to
person
you.
that will listen
That's
to
like
you.
number one with any
Any
doctor.
doctor. I don't care about the title, biological, non-biological. Of
Yeah.
course, there's certain things the biological dentist will test for. Like the biggest things are mercury, infected root canals. We didn't even touch on those, and those are huge.
Yeah.
But being with somebody who's compassionate and kind, and say you show them something that you saw from another biological dentist that you trust on Instagram or
Yeah.
online, and then being like, maybe I should look into that for my
Yeah.
patients. So it's kind of like the ripple effect. So for
Yes.
me, I can deal and I can speak. Like I've spoken to dentists in other states that are so curious to what as we're doing, and I tell them what we're doing. They've bought ozone machines and they've bought lasers just by talking to me.
Yeah.
And the key thing is compassion, kind, no ego, and you're in it to help your patient, and that's
Yeah.
it.
Yeah.
So word of mouth is the best thing in my
Amazing.
opinion.
And I learned so much from your social content, from your newsletter. How could people find you and follow you?
So I'm primarily on Instagram at Dr. Lydia, Leedia, and then you'll find everything there.
So DRLEEDIA.
DIA, yes.
Amazing.
Yeah.
Thank you so much.
Thank you.
This was so much fun.
It was amazing.
Part 2, we'll do root canals and
yes,
all the other.
fluoride and
Oh my gosh, all the other
wisdom
stuff.
teeth, airway.
Getting dental amalgams removed.
Yes.
So much more we
Yes.
could talk
Yes.
about, but
Yes.
we'll do a part 2.
For sure. Thank you so much.
Thank you.